Committee. Good evening to you.
Good evening.
Humanitarian crisis, that's rather overstating it, do you think?
I think the first thing that we have to say is how grateful we are to the Red Cross for the work that they've done, for stepping in, where actually the government have ignored the concerns and the problems our patients and our frontline staff have been facing. This completely reflects all of the things that we have heard from our frontline staff over the past year about the crisis that we are now seeing just the tip of the iceberg of.
But humanitarian crisis, I mean, that's exaggeration, surely, isn't it? I mean, that's something that happens, sadly, in Syria and Lebanon and all those sort of places.
Well, look, I think what we need to talk about is the fact that these numbers don't demonstrate the personal tragedies that we're seeing. The Red Cross work all over the world, and what they are talking about is what we are seeing in A&Es in places like Worcestershire. You know, we've already seen that there have been 2 deaths. A gentleman that died of a cardiac arrest after waiting 35 hours in their A&E. That is unacceptable, and the tragedy, the grief that their family are going through is unacceptable because it is a political choice that this government has made to underfund and under-resource our health service.
Do you think it's really as straightforward as that? Isn't it that demand for all sorts of medical services is rising and rising, A&E departments included?
I think it's a combination of so many things, but this chronic underfunding is at the heart of what we have to resolve if we are going to find a solution. And the reality is that is not just in areas like A&E. Fundamentally, we have to address the lack of resources, the recruitment crisis that we've got from GP services all the way through to social care to ease the congestion that we're seeing with increased demand, and also the under-resourcing, the under-staffing and underfunding of our service.
Do you think, though, that we all have to play our part here, and that A&E departments come under an enormous amount of strain? One thinks of sort of Friday and Saturday nights. An awful lot of people who've drunk a lot too much are in there. It's just talking about A&E for the moment. Well, now, that's putting a strain on the service. Should there not be more education about only go to A&E when you really need to?
I think it's very easy for us to say, well, look, let's look at this one specific area. But what we've heard from so many of those frontline staff, from start to finish, every day that we are seeing in every A&E, what we are seeing is that there is not enough funding, there are not enough staff. And although we are trying to squeeze more efficiencies from the system, we are at breaking point. And that is the reality that we need the Prime Minister to step in now and address, or there will be more casualties of this underfunding.
The casualties we hear about, I mean, they're awful individual cases, of course they are, and people being sent home and there isn't adequate facilities, what the Red Cross has really seen, hasn't it? But these are just a few, aren't they? I mean, you can't say that thousands and thousands of people are having a terribly tough time, can you?
I think what we're talking about is actually an increasing threat to our patient population. As we've heard today from the Royal College of Emergency Medicine, from the Society of Acute Medicine, this crisis is just getting worse. This January may be the worst, in the view of the Society of Acute Medicine, that we've ever seen here in the NHS. And that is a result, a direct result of underfunding, understaffing and under-resourcing. And whilst the continued attempts of the government to hide that fact are just not going to address the problem. We need to resolve that, and we need to resolve it now, or there will be further tragedy.
Dr. Wijay Surya, thank you very much indeed for joining us.